Hey, this is Dr. Waldron, and welcome to our health series. And today I'm going to talk about a topic that I think is something everyone should be aware of, and it is on the topic of whiplash, car accidents. Unfortunately, we have seen quite a few of those lately. You would think with less drivers on the highway that we should be having as many, but we have had an extreme amount of patients walking in that have been involved in car accidents here just in the last 2 or 3 weeks. And one area that I really want to stop and talk about for a minute, and that is just being stopped at a red light. If you're at a red light and that light turns green, stop and take a look at what's coming. We've had 6 cases here in the last 2 weeks where people have been broadsided, where someone has ran through a red light. Actually, all 6 of those where another driver ran through the red light. And it's amazing to me. Those are such dangerous accidents. Anytime 2 cars collide, the weight of these vehicles, the speed in which they're moving, the forces that go into the body, they're dangerous situations, and people are involved in them every day, and oftentimes brush off these injuries only to later have injuries that they have to take care of that were caused by the accident but just wasn't taken care of. And many people are very symptomatic. The ones we have seen recently have been patients who could hardly walk in the door, headaches, neck pain, back pain, a series of extremity type issues. But please just be aware. Number one, slow down. If the light is turning yellow, slow down and stop. Or if it is red, without a doubt, that is the reason to stop. So bottom line is, don't run the stop lights. And there's so much of that. I know it's happened here even locally, but we've had cases from all over Central Florida where patients have been broadsided with someone running through a red light. But on the topic of whiplash, when you look at these injuries, they're serious injuries. They're something we've been treating in our office for over 25 years. We've continued to try to perfect what we can do for a patient to properly diagnose them after being involved in a car accident, not just from the standpoint of having neck and back pain, but one of the most important portions is possibility of mild traumatic brain injury. And those are serious conditions. Patients oftentimes come in with post-concussion type syndromes where they've got headaches, they've got neck pain, they've got dizziness, lightheadedness, nauseation. Those are symptoms related oftentimes with post-concussion, with the little forces being introduced into the brain or the region of the neck and the head. And those need to be addressed. They need to be checked out and evaluated. And when properly done so, oftentimes you may go to the ER. They may do a CT. They may do an X-ray. Sometimes they do neither. Just depends on what has happened. And not every patient goes to the ER. I think it's kind of a call on your part if you feel like you've had significant injury and that you're not really comfortable at the time. It's something you need to consider doing to be checked out. Otherwise, a lot of patients will contact our office, get into our office initially because they know we deal with a lot of personal injury or car accident, truck accident type patients. We've had quite a few motorcycle accident patients here this last year. Phenomenal for people to get up and be able to walk away from those accidents sometime, but oftentimes with substantial injury. So just keep in mind when you're looking at the different scenarios when it comes to being involved in these car accidents, in the state of Florida, you have a 14-day rule. If you're involved in a car accident, you have 14 days to report that and to utilize your insurance. If you don't report and you wait 15 days and you come to my office or you go to the ER, you do not have any coverage at that time. So you have a policy, whatever insurance company you have, in which that coverage allows you the PIP coverage for a 14-day period, or at least to initiate that. If you don't initiate that, we have had lots of patients show up here on day 15, day 16, patients who are hurting and pain and a lot of discomfort that should have been able to get their care, unfortunately not covered by their insurance. And oftentimes health insurance is not going to provide you with the level of care that you should have when it comes to these injuries. So just something to keep in mind. Try to utilize your auto insurance if you feel like you've been injured, if you've had an accident. Oftentimes these injuries may take a week, 2 weeks, sometimes 3 or 4 weeks. I look and go, at least be evaluated and determine whether there's an injury there that's maybe not maybe is not symptomatic at the time, but progressively begins to get tight, stiff, sore, and step back and take a look at the accident that happened. How bad was it? Did you get rear-ended by someone at 40 miles an hour and you just happen to be one of those that are not real symptomatic? You want to address that. There's no doubt that you're injured. The question is how bad and how long will it take before you become symptomatic. So just something to keep in mind. Rear end collisions are one of the worst. We do have seen a lot of these broadside collisions, head-on collisions. We have seen a few of those here in the last 2 months. But again, all severe accidents, none to be left considered being light-handed as far as that goes. When you look at these collisions, I do recommend if a patient gets injured, in a car accident, don't hesitate to go to the ER and be checked out. Sometimes these things happen on the weekends. I try to make myself available to our patients in our office 7 days a week, but sometimes if they don't have my number, can't reach me, I look and go, make sure you go to the ER. Even if you don't think your injuries are serious, if there's something that just doesn't feel right, go be evaluated. Other than that, oftentimes you will come to our office after being at the ER, maybe getting some temporary care or maybe getting some x-rays or a CT scan done. Because in our office, we're going to further evaluate you for soft tissue or connective tissue injury. And those are very important. Those are the ligament structures, the tendon structures, especially when we're talking about the spine. When you injure those components of the spine, you weaken the spine, you increase the likelihood of long-term degenerative changes. I think everybody wants to blame getting old on getting old. And oftentimes when you look at a car accident, you initiate trauma to the spine, you change the mechanics of the spine, you alter the stress on the tissue, and those tissues change from that point on, and typically are going to progressively get worse as time goes on. You may be 20, you may be 30, 40, 50, you may be able to withstand that accident to where you say, hey, I'm okay, everything's okay, and you'll find out 10, 15 years later things aren't so okay. So better to address the issue. I always say women are very good caretakers. They take care of themselves, they take care of their children, and they try to take care of their husbands. And the point I make about that is be a good caretaker. If you get in a car accident, get taken care of, get evaluated, get checked out to make sure everything is okay, that you heal properly. So in the next 5 or 10 years, you got a neck or back that is in good shape, not something that you're going back on 5 years down the road with a neck issue or a back issue, and you end up having a herniation that just progressively gets worse. Oftentimes you can cause it, these accidents can cause a herniation, and you may not be so symptomatic, but as time goes on, the additional stress abnormally creates more strain to the disc, and oftentimes you show up maybe 6 months later with neck pain. So definitely get these issues. They are different than any other injury out there when you look at the forces that go into the body when two cars collide, or if a car goes off the road and hits a tree. I've had a multitude of different ones. I've had a lady actually walk through my office into my doors with a broken neck after running into a pine tree. She went to the ER, actually sat there for a period of time, decided she didn't want to wait, so she got up and left. And in just a conversation, she asked me maybe if I could help her. She came into the office, we took an x-ray, she had 3 fractures in her neck. We sent her for an MRI, confirmed those, sent her to the neurosurgeon, and believe it or not, very rare case. He looked at me, and even the neurosurgeon indicated, said, listen, she should have surgery, but she's not having any neurological symptoms. She was already 5 weeks post-accident when I first saw her. So pretty unique. You can have some serious injury and still get up and walk away from an accident like that. That's why those kind of cases I look and go, get checked out. Don't leave it for chance. Don't leave a question mark in your mind. Come get x-rays or come get a checkout, evaluation, exam. Make sure everything is okay after that type of a trauma. MRIs are something we utilize as a tool to diagnose herniated disc or bulged disc or prolapsed disc. In our office we use and recommend for the MRIs to be read by a neuroradiologist. There is a difference there, in my opinion, about how the eyes read these scans. They're not all just black and white. So an MRI is well read by a neuroradiologist, and that's what we prefer, and that's what we suggest in our office to make sure we get all the details of the MRI to make sure that patient is provided the best care possible. Also, we refer to medical doctors that we work with, orthopedic surgeons, neurosurgeons. In our office here in the next 2 weeks, we'll have a medical practitioner in our office who will also be sharing responsibilities with seeing these type of trauma cases with just the basics, the anti-inflammatory muscle relaxer, maybe a trigger point injection to help calm symptoms down to where we can continue to further diagnose that patient through MRIs, also through a process that we call DXD, which is a digital evaluation of a motion study. So we take the patient through a flexion extension, so we actually take the computer images and we measure those to see how much damage has been done to the neck by way of each segment, how much movement is there that shouldn't be there. So we're able to document that and further confirm the severity of injury for that patient. So we're able to look at the ligament structures and any damage there. We look at the MRIs to further determine the injury to the disc, and then that also gives us a guideline on the care plan that we're going to provide for that patient, and also the appropriate referrals for that patient to have a second opinion or even a third opinion. And also a lot of that is also to further evaluate for mild traumatic brain injury, which is not uncommon. It's just unfortunately not very often checked out. People end up with symptoms oftentimes months after an accident, didn't get evaluated, who may very well have sustained mild traumatic brain injury that ends up causing complications even as life goes on. So again, get checked out, be properly evaluated after being involved in a car accident. The topic comes in, that I'm often asked about is an attorney. In my experience over the years, I have found that representation by an attorney, by a good attorney that is going to take your case on, not just another case that they're going to shuffle across the desk, and I don't mean that sarcastically, but I mean an attorney that's going to take interest in your case and make sure that for whatever injuries we document, the reports that we provide that indicate whether there's injury or if the injury is mild or if it's a severe injury, is taking that information and really going to bat and making sure that there is an equal exchange for the injuries you've sustained. I think without a doubt there's a lot of people injured worse than they realize with these accidents, and unfortunately they don't realize that until years later. So knowing the diagnoses and knowing the severity of these injuries and having an attorney that can represent you and make sure that there's an equal exchange between you and the insurance company or the opposing parties. And number one, is just for a fair exchange. It's not about getting something more than what you should, but at the same time, with injuries that you've sustained, injuries that are going to impact your health and your well-being over the next 10, 15, 20, 30 years of your life, you want proper representation. In our local community, we've got some great attorneys that we work with many different attorneys, just helping the patient. Our goal is to document what's there, provide that information to the attorney so he can properly address any issue with your insurance company, and to make sure that at the end that you guys have an equitable settlement that you can walk away from. Unfortunately, a lot of these injuries that you receive, it's in a sense you're going to trade money for pain. What level of pain are you at? What kind of injuries did you sustain? Now, if it gets much more severe, there are some very intense injuries that we deal with, some mild traumatic brain injuries. You look at some herniated discs, some of these cervical and lumbar, how it affects the person's workplace and their ability to perform their job. Those cases can become very big, and oftentimes it takes more work by the attorney. It could take some depositions, different things like that, in order to make sure it's properly settled. But a lot of them are typically settled with the attorney, speaking with the adjuster and determining what that case settlement might be. So it's important. I think representation there is important. We work with a lot of attorneys. We do have patients that choose not to have an attorney, and that's fine. That's your prerogative. And I just tell them, be cautious with what you're doing, as far as with getting the care that you need. And if you're restricted or limited, it may be something that then you consider if they're not taking care of you properly. So a lot of things to be considered. I think the thing is, nobody goes out today planning on being in an accident. But when you do, just take those few things I talked about today. The state of Florida has a 14-day rule, so don't wait, don't put it off. I've had a lot of very unfortunate, very upset patients that have walked in the door on day 15 and there's no coverage. You have no coverage other than your health insurance, or if you have no health insurance, you have no coverage yet you had a policy that would cover your care with your insurance that you pay for on your vehicle. So go get checked out. Don't just put it off. Oftentimes people get stiff and tight and sore and they think they can tolerate that. Go be evaluated. I told you about the lady that broke her neck. She walked in our door with no neurological symptoms, yet had a broken neck in 3 different places. So that can happen. That's a severe kind of eccentric case, but that does happen, and that's a real life story as far as that goes. Again, MRIs help us confirm the severity of your injury. Also, ligament studies and a motion study helps us determine ligament injuries. So we're really able specifically to address your injuries at a very minute level. I think that's important. That way you know how bad you're hurt, where you should limit yourself, and allow yourself to recover as much as possible. So again, we look at sprains, strains to the neck. We refer to a lot of that as being whiplash. I hope this information today has been helpful. I hope that you'll take it. If you are unfortunately involved in a car accident, take the time to call your insurance agent, look at your coverage, get in and get checked, whether it's the ER, whether you call our office, Waldron Chiropractic. We've been seeing these type of injury cases for 30 years. We are very good at handling these cases and managing these cases and helping patients not only recover and get back on their feet, get back to work, get back to a level of function that oftentimes is very difficult to get back. We have certain machines in our office that also help with strengthening. So very important, once you've been damaged or injured, that you get the treatment, but then we can also rehab and strengthen you to a level that you can get back out and do your job. If you have any questions in regards to healthcare in relationship to a rear end collision or an automobile accident, don't hesitate to give our office a call. Our number is 863-382-4445. Take the time to call. It is something you'll be glad you did, especially if you've been involved in an accident like that or been injured and should be taken care of. I hope everybody has a great day. Stay safe out there. I know this pandemic is about to drive everybody crazy in regards to being at home, but keep your social distancing, continue to do the things that are being recommended in order to stay safe, and again, work on your immune system, maintain with good sleep, drinking plenty of water, take your vitamins, eat quality foods. Guys, build health from the inside out. It's not so much from the outside in. Manage and maintain on a day-to-day basis. You guys have a great weekend. Thanks for listening.